Hi, I'm Brian Benedict. I'm a retired firefighter, Army veteran, and been doing life and health insurance since I was 25 years old, so over 35 years. And, with 65 million Americans out there actually on Medicare and 12,000 turning 65 every day, I think there's no better time than to have an actual person that you can sit down with before, during, and after getting on Medicare. The one thing I will always say is there's no HR after you retire. So what I want to speak today about is, can someone under 65 be eligible for A and B or an Advantage plan? Can they? Okay, so let me talk a little bit about the eligibility requirements too. So there's one category of individual that I really believe could benefit from someone, a real person that's a health insurance agent that can do both Medicare Supplements, which is a Medigap policy, and Medicare Advantage, which is a Part C. What category am I thinking about? Well, I tell you, it's the under 65 category. Under 65. So many people think when you're under 65, what does that have to do with Medicare? So I'm going to tell you. Here's the deal. Is under 65. Actually, there's some people that can, many people actually, that can get on Medicare, original Medicare A and B through Social Security. How can they do that, Brian? Well, if someone under 65 is on Social Security disability income, then after 24 months of getting that income, they receive that red, white, and blue original Medicare A and B card on the 25th month. So the month after 2 years. So once they've been collecting income for 2 years, on disability income for 2 years, that 25th month, they get issued that red, white, and blue card. Now here's a crazy thing about it. The crazy thing is that red, white, and blue card, when it comes in the mail, it's crazy. So that comes in the mail. It's a nice little, kind of large envelope, actually, for a little card, but it's like a large envelope. And you'll see that. They'll open it up. There's nothing that tells you what to do with that card. There's no summary of benefits. There's no explanation of anything. It's just, you received it. And I have people that have been in social work. I have people that have had kids grow up from birth with disabilities. And nobody, maybe one out of the whole time I've been doing this, knew anything about that card and what that card could do for them. And so this is a crazy thing, and it just bothers me, honestly, because so let's go back for a second. Let's go through a scenario real quick, and I want you to think of somebody that maybe has had a child that had a disability, or let's just do that first. Let's do that. So that child was born with a disability. When that child becomes an adult, more than likely, if they start getting at 18 or 19 or whatever age, if they start getting Social Security disability income, 2 years after that, 2 years and 1 month after that, that family is going to receive a red, white, and blue card. That child could be 21 years old, 22. It could be young and receive that card. And that card doesn't tell them anything about what they could even do with that card is so terrible. I don't even get it. I really don't even get it. It bothers me. Anyway, so now they have that card. Now that card, some of my earlier videos, you'll see that most of the videos I do, that red, white, and blue card by itself is probably one of the worst cards you could ever have. All right. So why is that? It's because Part A, hospital stuff, and Part B, medical doctor things, there's a lot of gaps. There's a lot of expensive gaps within those two. And honestly, I've had somebody that's been on disability that has used that card, just that card alone, thinking it's a good thing and doesn't knock down some costs, yeah. But what makes that card really bad is there's no maximum out-of-pocket limit. So what do I mean by that? So that card, anything you pay in that card, using that card, doesn't go in, I always use a bowl of chili, doesn't go into the bowl of chili. The lid is typically a maximum out of pocket. Okay? If all those expenses go in the bucket and it reaches the lid, that's all you pay for the year. That's how group health is. It could be a high deductible plan or it could be a regular group health plan, but you have a safety net. The most you'd ever pay is this cap. Okay? That red, white, and blue card does not have that. It's terrible. One example is someone that unfortunately got stage 4 cancer and just had that card alone. And just within 1 year had over $200,000 worth of bills that were her bills. And unfortunately, that's just unacceptable. But anyway, so let's kind of go towards the majority of those folks that are under 65, that are on Social Security disability. I think especially of the ones that parents are still taking care of them. Many of them are really cautious, and I don't blame them. I mean, there's a lot of scams out there, a lot of fraud, that's why it's very important to have an in-person meeting, in-person relationship, get to know the person like myself. I don't care whether it could be Zoom, it could be anything. Just get to know this person that you're going to be dealing with, and not just listen to what they have to say. So this is one of those times where just a regular health insurance agent that can only do a supplement plan has no clue about this side of what I'm talking about, because they're not certified with the government to do prescription plans or Advantage plans. And these children that are in their 20s or 30s and they're disabled, they're on SSDI, they get that red, white, and blue card. As soon as they get that card, they are eligible for one of those Advantage plans. And many people can't even get these kids on their own group health plans or on any plan. Some, I mean, it's just all over the board. Some can, some can't. But that card by itself can break you. It can break a whole family. And that's why you have to talk to somebody that can do both sides of this, because you can't give somebody that supplement at age 20, 21, 22, okay? But you can, as long as they have that card, you can give them a Medicare Advantage plan. And what that does is it makes this A and B better. A and B is kind of like combined in the Advantage plan. You never can get rid of the A and B. So because if you ever got rid of that A and B card, Advantage would go away. So you never want to get rid of that card. And so you have the Advantage plans over here that these kids can get in their low 20s if they grew up disabled and they're on Social Security disability income. And it's such a great thing, but again, I think you just have to talk to somebody that's just a trusted advisor, because not many agents out there, not many health insurance agents are certified to do those plans. And a lot of people get on bad plans, wrong plans. I can't tell you, I just don't understand why no government official does anything about this stuff. All the scams, all the telemarketing, all the TV stuff. It's just a lot of it's misleading, and it's luring people in so they can put them on whatever plan they want to put them on. And so, but these, I have customers that are in their 20s. I have customers in their 30s and 40s that have been collecting Social Security disability income, and it's such a benefit because they're guarantee issue, and there's no delay on previous health conditions. They accept those right off the bat, and typically those plans are $0 a month. And so, and they come with dental, vision, hearing, and a prescription plan. And I'm telling you, it's life-changing. So if you know someone that's in that position, share this video. And if I can help them out, or if I can guide them to somebody that can help them out, I know people throughout the country that would be available to help somebody if I wasn't able to. So make sure you subscribe, share this with somebody, like the video, and I just want to tell you to just be safe out there.